Whether one admits it or is in denial, the fact is India's coronavirus cases are going through the roof. Yes, it's a fact. If you look at just pure import of numbers in terms of positive cases, right now we stand at over 43 lakhs. And this data has come from nowhere else but the Health Ministry of India. And it's not that we flattened the curve continues to rise. Certain states, including Delhi, are recording extremely high import of positive cases day by day. And the surge is only growing. Even though we are bang in the middle of September, the curve which we thought we would have flattened by now is nowhere near flattening, but only seemingly rising. Now, with that in the backdrop, it's interesting to look at what's happening in our neighborhood country. Take a look at Pakistan. Pakistan, if the WHO is to be believed, has flattened the curve in the process of flattening the curve.
Pakistan deployed the infrastructure built up over many years for polio to combat Covid-19. Community health workers who have been trained to go door to door vaccinating children for polio have been utilized for surveillance, contact tracing, and care.
It's been 6 months since the coronavirus struck globally, but Pakistan appears to have dodged the worst of the pandemic. In a population of over 22 crores, Pakistan has recorded only 29 lakh cases, which include 2,82,268 recoveries and 6,335 deaths. Currently, there are just 8,909 active cases in the country. Pakistan's declining coronavirus cases have left health experts baffled as they are trying to look for reasons behind the success. Now, the Pakistani people attribute this fall in the numbers of cases to its demography, its geography. So in the midst of all this data, the question is, has Pakistan successfully flattened the curve? Well, there are many reasons which seem to suggest that it has. And the reasons behind it? Well, one that is being discussed is that the median age of Pakistan is extremely young. If you actually look at the median age of Pakistan, it's 22. Now, as per whatever little research we have on this new coronavirus, we do know that it impacts the elderly a lot more. In terms of the fatalities of the elderly who contract the virus is a lot more than the younger population. So this, in a way, could be working for Pakistan because it's generally a younger population. Now, another reason that is being attributed to very less cases coming in Pakistan is the fact that they might just not be testing enough. And we've seen it, if you don't test, the numbers don't come up, and you can pretend, or at least on the face of it, in terms of just numbers, seem to have flattened the curve while your cases are only growing, but you're just not testing, or you're not putting a number on those cases because you don't have the documentary evidence to suggest so. In fact, Pakistan government has said the virus outbreak was controlled in the country due to concrete measures taken by the government through its trace, test and quarantine strategy. However, on ground, it doesn't seem to be so. Now, according to reports in the last week of August, Pakistan's positive test rate, a key indicator as to whether there is adequate testing, was 2.09%, well within the World Health Organization's 5% threshold for indicating that a country's outbreak is presently under control. However, observers say that with only limited testing, the true numbers will never come out. Well, another reason which at least the Pakistan government has attributed to itself for the low count of positive cases is what they say was a very smart lockdown strategy. As per Pakistan, the Imran Khan-led government, it believes that it's actually made a very smart lockdown plan which actually restricted the virus when it had to. While experts are not able to provide any particular reason for the decline, anecdotal evidence from hospitals across Pakistan support the downward trend. While healthcare facilities were initially swamped, doctors across Pakistan are now saying they're no longer seeing a surge in coronavirus cases. Is there a chance of a second wave? Europe is talking about a second wave of coronavirus. India itself, many in India actually also say that India could be in right now a second surge of the coronavirus wave. Is that a possibility in Pakistan? Well, Pakistan, which was in a heavy lockdown mode, has now opened up. Now, opening up in terms of malls, in terms of theaters, could very well bring in a second wave of infection. And ultimately, the WHO has said that the virus is not going anywhere until we find a vaccine, until we see an actual reduction in terms of numbers, it's not going anywhere. India, anecdotally, clearly seems to suggest it's not.